Hello, and welcome to Dental XP. My name is Miguel Stanley, and I work in Lisbon, Portugal. And I really appreciate this opportunity to be here on Dental XP on this global forum to talk about a philosophy that we have in our clinic here in Lisbon called No Half Smiles. And this is a very simple philosophy where basically we practice complete care dentistry, and this is something that's only achievable by having a team approach. When we analyze and when we look at a lot of these amazing lectures on Dental XP, you will find very highly specific cases, some amazing full mouth cases and some very isolated cases. I'm not going to go into a lot of detail today during this presentation. This is my first webinar on Dental XP, and I'm looking very forward to sharing with you something that I think has a great impact in dentistry, which is the way we treat our patients on an emotional level as well. So when we look at what we do nowadays, everybody's very focused on his or her speciality. And, you have your implant surgeons, you have your people that do fillings and cavities, your general practitioners, your prosthodontics, your orthodontists. And we don't do just these things. A patient doesn't come in many times looking for a specific area of dentistry, but coming more over for searching for a solution for their smile. And when we create smiles, we don't just do a half a smile, we do a whole smile, and the smile is seen as a whole. And this is our approach to things. So how does it work? Well, it kind of works in the very first appointment and the way you look at your patient. Most patients, they come in and they will tell you what they want. And Dr. Morris Salama is one of the first persons, and David Garber, that taught me many years ago that we have to separate from what our patients want to what our patients need. And we really should listen to them, because sometimes we can find that the highest success rate comes when you marry not only what your patient wants, but also what they need. So I'm going to walk you through a couple of cases. I think we have 5 cases in this presentation today. And feel free at the end of this presentation to email me or participate through Dental XP's means and get in touch with me and my team, and we'll be more than happy to discuss specificities of each case. But once again, this is just a clinical overview so you can see how we treat our patients here at White. So George came in, and this was his smile when he came in, and he had a hard time smiling. He was somebody that had a lot of difficulty showing us his smile, and the reason is that he had a removable denture for the last decade, but substituting his 2 central incisors. Well, his central and his lateral here in this case. He'd had a trauma to his front teeth quite a long time ago. I think he was 19, 20 when this happened. This is a very important phase for a person's identity and social identity, and he had a lot of stigma and a lot of hang-ups about his smile. And when he came in, he was very specific about what he said. I need new front teeth, and this is what I want. And our job was, as dental surgeons and as a team approach, was to see what other things he had to do. And as you can see in this, we have quite a couple of situations here that he didn't find important. For example, he had some open fillings here, some open cavities. He had cavities on back teeth. He was missing teeth in his lower right quadrant. He had roots left over. He had space in between his front teeth that later on would become an aesthetic problem. He had inflamed roots here. He had old amalgam fillings, and the spacing in between his teeth wasn't perfect. And if we go back and look at this, a lot of patients, when they look at this, and a lot of dentists, when they look at a case like this, and they will start looking at the, as I like to say, they'll start looking at the trees, which is what the patient wants, and not at the forest, which is an entire picture of what our patients actually do require. And these spaces, interdental spaces, on his lower teeth, which aren't really a health issue, once we finish the top, would become a cosmetic issue down the line. So another great lesson I've learned from a lot of teachers here on Dental XP, and most of them from Team Atlanta, are to always start from the end. So you treat your cases from the end. And you know that once you finish the top case aesthetically, your patient is going to ask, well, what about these spaces? So don't be scared to write everything down, everything you might think your patient will need at the end. So here we have our initial panoramic X-ray, and we can see quite a couple of things here, quite a couple of problems. Now, he is missing some teeth at the top of second quadrant. His sinuses have dropped, so if I was to do any implant placement here, I would most certainly need to do a sinus lift. Here we have a mesialized 36 with a very large cavity. Somehow this tooth was not hurting him, and he did not find this of primary importance. He had a root canal on his remaining central incisor, was missing these two teeth here, some old fillings. He had some spacing issues up here, a mesialized 47 and a broken and partially endodontic tooth 45. Now, if we look at this problem, one of the main problems I see as a mouth, so one of the main problems I see is space management. So immediately I sent this case, I called in my orthodontist, and we tried to study how difficult it would be to place these teeth in the right proportion for dental implants, or to mesialize this molar. I also called in my endodontist to see how good this root canal was, and I called in my cosmetic dentist who does the veneers and the bondings, and asked her how hard it would be for her to bond these lower teeth. And then I sat with my implant team, and we sat and we discussed what would be the right treatment planning for this case. And we started seeing that what this patient wanted was aesthetics. But what he really needed was function and improved health. So you'll find in most cases nowadays, a growing number of clients will demand aesthetics over health or function. And this is very sad. And it is our duty as a dentist and as dental surgeon, as practitioners, to educate our clients that first we have to start with health, and then we have to start with function, and only last do we do the aesthetics. Now, of course, if you have a combined team approach, you can actually do all of this simultaneously. But the hard part here is that your client, most clients, have a limited budget. And let's face it, there's a world crisis going on. Things aren't the way they used to be. And it's very hard to try and explain to your client or your patient that they are going to have to do a little bit more than they bargained for. So in this case, we managed to convince our client that in order to keep his cosmetic area functional and durable and to have a long-term predictable result, that he would have to place his posterior teeth. But of course, we started with what he really wanted, and that was his front teeth. This was emotionally the most important part for him. So sometimes if you start with what the patient needs and not with what they want, they might get unmotivated and might actually start thinking about going somewhere else. So we actually started with what he thought was important and imperative, which was the anterior region. Very simply, we raised an aesthetic buccal flap because after a CT scan, we saw that he had a thin cortical bone here. So we placed these implants with a tissue punch technique, and we made sure that we had absolutely no fenestration here in this area. Now, it's very important this because later I'm going to get to this, that after about 3 to 6 weeks, we had some bone remodulation after implant placement and actually had to go back. So I probably should have actually grafted some bone here during the surgery. So here we can see these implants being placed, and we did the suture and placed some healing abutments there. This is 2 months post-op. Now, this is a very rare photograph we have here, and something that doesn't happen that often, which is we actually have a papilla maintained here, and partially I believe this is due to the kind of implant that we used. This contains the laser lock technology, which also helps the connective tissue and the supracrestal fibers to adhere to the implant. And for those of you that are periodontal surgeons, and for those of you that negotiate more with the soft tissues, as we go through this case, you might find that this is quite interesting what happened here. So this is the post-op. Notice we placed some more implants in his mouth. We have some implants here at the back, and you can also see he has some accumulation of plaque here, and we are quite rigorous with the hygiene control of our patients, and we actually gave him a hell here for not keeping his hygiene as good as he had promised us. Sometimes the dental hygiene is overseen in these cases. People seem to worry more about the implants and the prosthodontics, and just, I don't know how, sometimes we forget that the patient needs to see the hygienist. Now, not everybody has a large team. Maybe not all of you seeing this actually have hygienists, but it's very important for you to control the hygiene during the healing phase. So here we have a few weeks after the implants, and you can see we have several implants in the mouth. We still have some decay here, but the hygiene is controlled. This is, I'd say, this is about 3 months post-op. You can see all the healing here, and that papilla is still in place. This is a temporary crown that we have here, and during this phase, we will send this patient to do the treatment of his cavities, to the endodontist to redo his endodontic treatment, and basically fix everything up. Now, our decision here, and you can see through this this lab phase, was to not do any orthodontic treatment. What we did was we designed our full mouth rehabilitation with ceramics using intelligent ceramic placements through our lab technician. Now, our lab technician's name is Stein, and he's quite a wonderful chap. And as you can see here, we have the 2 implants. These are zirconium abutments, the prepped teeth, another implant, and this is the bridge that we're going to have in the second quadrant because we had no bone here. Our patient wasn't interested in doing any bone regeneration, so we were perfectly comfortable with placing a bridge here. And you can see that where we had some bad positioning of teeth, by the way that we did our preps here, we created space enough for him to do create teeth in the edentulous areas. So, moving on, of course, we like to use IPS Empress crowns. I've been using these for many years now. We use Evoclar ceramic, the Emax ceramic. We have great results with this, and here we go. This is cemented crowns. This is the day that we cemented the crowns. As you can see, we also did a bit of bonding on the bottom teeth to close the gaps. This is a very simple procedure, and once again, I'm not going to go into each specific treatment that we do here because there's quite a lot of work on each case. I have 5 cases I'd like to present to you today, and please feel free to get in touch with us at White or through Dental XP so we can discuss any specific question you might have. So I wasn't very happy with the soft tissue up here. As I explained earlier on, we had some bone remodeling here. So we just went back in, we did an aesthetic buccal flap. This is discussed by Marius Steigman. He does a lot of this work, and you can, it's hugely helpful at rebuilding substantial tissue depth. So here we have the placement of the alloderm, and I like to suture this with a nice 5/0 nylon suture. And here is 1 week follow-up. You can see that's all closed up nicely. We've got a lot of volume back, and this will fall very nicely into place. And once again, look at how we've given this patient all his teeth back. We've closed the gaps at the front. We've taken a level further with some periodontal surgery to make sure that the volume of the soft tissue is also nice. But please notice how the actual architecture of all his teeth, even despite having undergone periodontal surgery only 1 or 2 weeks after putting all these crowns in, this is all not going to be affected. So this is about 2-month follow-up after having rebuilt that soft tissue, and as you can see, it's all healing very nicely. And it's not a perfect case, but if we push this forward, you can see that a client, that the patient that comes in that is missing a lot of teeth, that came in for a very specific treatment, which was just to do his front teeth. We gave him a lot more than he requested, and as you can see, we have done some very, very nice endo work here done by my colleague, Dr. Giulio, on some lower teeth with a nice CEREC crown on that. We've got some bridge work, we've got implants, we've got zirconium abutments, we have another couple of endos, post-in cores. We have a complicated 4-canal implant treatment on one of the teeth, and once again implants and some bonding on this front teeth, and quite a complete case. And you can see here the final panoramic x-ray, and there's nothing missing in this mouth. So he has posterior function and anterior aesthetics. And I firmly believe that if we had just done what the patient had asked for in the beginning, which was just to fix these top teeth, that he never would have had the wow factor. He never would have walked out and said, well, you know what, it was a lot more than I expected, but the fact is that my mouth wasn't in a bad state, and I actually feel a lot better because this patient is chewing better. He's got more posterior supports. This will give anterior longevity and an overall sense of well-being to this patient. So this is a before, after, an after, and this guy actually didn't like smiling, and now he smiles quite a lot. I think there are very few cosmetic procedures that actually can change a person's expression as much as a perfect and healthy smile. So here you have a happy patient. And now let's go to the second case. Here's a patient. She flew in from Switzerland, and she had been seeing a periodontist for quite some time, trying to manage these bottom teeth. And as you can see, they weren't doing that well. There wasn't that much mobility, how strange as it may be, but she wasn't happy with aesthetics. And she had some very old crown and bridge work at the top. She was also missing some teeth here, and she used a denture for her back teeth. So here we can see a left and right shot. We have some difficulty here, so like lack of papilla, some old bridge work, no teeth at the bottom, a loss of bone and gingival height here. So once again, patient says, how do I get a perfect smile? How do I get a better smile? And here we have the initial radiography. We can see she has some old roots with some infected periodontum there. So we've got some perio lesions here due to infection, a lot of bone loss in the anterior region. She's got some roots that are infected there. Some old endo treatments at the top, and a lot of the old metal ceramic crowns that had done her a great service for many years. I think she'd had these for 20 years. Quite frankly, I think that's money well spent, and I hope that my work lasts that long. So people have to stop thinking that our dentistry is going to last a lifetime. I mean, it's nice to say that, and sometimes things go wrong, and I think that patients are living a lot longer, and we really have to start thinking the way we manage what we call forever. So here we have some of the cool things that we did, not everything, but you can see here our endodontic department managed to remove a file that she had in a premolar. I mean, look how small this file was, and redo that endodontic treatment completely. Why is this important, and why do I want to talk about this a bit on this webinar? Is because not many of us out there like endodontics, and it's a very, very hard area to actually appreciate. However essential it is. Now, had we not been able to remove this file from her root, most probably we would have had to extract that tooth and substitute it with an implant, which is more costly, and nowhere near as good as a natural tooth. So we here in our clinic, we're huge fans of endodontic treatment, and shortly, over the next couple of months, me and my team will be starting to put up quite a few more cases of how we do endodontic treatment in our clinic. So please feel free to get in touch with us so we can share with you some of our techniques. So once again, this is just jumping quite a few steps here. Here we have our clinical try-in of what we ended up doing, and I'm going to show you what we did. So what we did here was this is the end case. So once again, full mouth at the top, full mouth at the bottom, and this is what we did. So I'm going to show you the x-ray. We placed dental implants where she was edentulous. We substituted all her endodontic treatment out, area regions over implants, just because sometimes the full ceramic does fracture. So out of the aesthetic zone over implants, I like to use metal ceramic. And on the bottom, we took everything out and did immediate implant placement. So on the same day we took out all of her bottom teeth, we placed these 7 implants, and we did some minor grafting. I love to do simultaneous grafting with my implant placements. So as we use the drill, and I'm going to talk about this further down the line, the actual preparation of the site at low speed. And Dr. Salama has a lovely paper from quite a few years ago that anything under, I think it's 120 rotations per minute, you keep the cells alive. So this actually, the preparation has to be low speed so we can actually keep that the quality of the bone intact. So a lot of us tend to do this very fast and collect a lot of bone, but it is actually necrosed due to the high speed and high temperature of the burr. So here we have all these implants placed, and this patient actually had about 8 visits to our clinic to get this level of this quantity of work. We found that it wasn't in her best interest to save any of these bottom teeth, but it was in her best interest to save all her top teeth. Now, this is once again an approach of a team where I know that my endodontic team can save this person's teeth. I know that we can, with the combination of endodontics, prosthodontics, and good implant work, we can save the best structures, remove old structures, and replace them with the new ones, with this complete overview of a person's mouth. And here we have a before and after. And it's quite funny, if you look at this photograph, she's kind of stopped wearing so much makeup because she feels so much more comfortable about a smile that she's actually letting herself age gracefully, whereas before she was trying to hide the way she looked because of her smile with the platinum hair and a lot of makeup. She's actually going through a lot more natural pace today because she feels a lot more comfortable with her smile. She's chewing better, she's eating better, she's digesting better, and this is such a great way to give happiness to your customers and have happiness to your patients. And I just don't feel that if we do these partial treatments over a long period of time, your patients actually get the benefit of the magic of dentistry.